If you're facing a cancer battle, there is a group of people here in Cincinnati that you need to meet. It's Cincinnati Cancer Advisors, and Steve Abbott, who's the executive director, is with me. And tell us what it's about.
Thanks for the question, Jim. Cincinnati Cancer Advisors is a really unique, what I call a charity oncology practice. It's my own terminology, but consultative oncology. And so we were founded in 2018 by Dr. Bill Barrett, who began seeing patients on the weekend free of charge, providing second opinions, because he had seen so many cases over the years where he felt like a secondary case review would be beneficial to a patient. And so he started out with the idea of like seeing patients free of charge, seeing how the response would be, and it was a very enthusiastic response. So we opened our doors in January 2020, just in time for COVID, and saw over 200 patients that year, all free of charge.
What makes CCA different than other oncology practices?
It's funny. We use that term. We use the term ourselves, the CCA difference. In fact, it's even we use it as the title for our newsletter, as a matter of fact. But because it is so different, and I recognize that. I'm a cancer patient myself. I'm a 10-year cancer survivor, and so when you go to a typical oncology visit, you're in there for about a half an hour, and what characterizes most visits is people have been recently diagnosed, and they don't know the first thing about cancer, and that's good because you don't want people walking around thinking about cancer when they don't have it. But all of a sudden, they're dropped on their head. They're thrown into a world where they're hearing a bunch of terms that they don't understand, having to get themselves quickly up to speed. They may have to make treatment decisions, among other choices, and you've got about 25 to 30 minutes to do that, and it's overwhelming. And so what makes us very, very different is patients come in, they spend 2 hours, 2.5 hours, or I'll say as long as it takes, to come away with a thorough understanding of their diagnosis and what their treatment options are.
You're not curing them. You're not treating them. You're consulting.
We are consulting strictly. And by doing it that way, we have no financial incentive. We don't take over a patient's care. Our main incentive is to educate and empower the patient and to work directly with their treating oncologist to try to optimize their outcome. There's no financial incentive. We don't bill the patient. We don't bill the insurance company.
When I'm scared to death and I get that diagnosis from my doctor, I'm like, I need a second opinion. They can come right to you, to Cincinnati Cancer Advisors, and you're going to offer them that second opinion free of charge.
Yeah, exactly. And we're perfect for we're perfect for what I would call the kind of the inquisitive patient, the patient that wants to. And it's important to point out, Jim, that you can come in and what you're probably going to hear most of the time is, "Hey, your treating oncologist has got this." That's exactly what we would do. And bear in mind, this is not. I'm not speaking ill of clinics that provide free services, but I mean you're dealing with some of the preeminent oncologists in the city, some of which have chosen to leave the current healthcare system so they can spend this type of time with patients and provide this level of consultation. So, oftentimes they're going to agree with it, with what's being prescribed, but there may be times where they say, "Hey, you know what? Let me check because I know a guy at Dana-Farber who may be one of the world's top expert in this type of cancer, and let me see what he says, and I'll report back to your doctor."
It's got to be comforting to know that there's someone that's in my corner when all of a sudden I'm hit with this news. And family's one thing, but then to have someone who actually knows things is another thing.
Exactly. And, I can speak, Jim, I came as a patient first in June 2020, and I was so impressed with everything. I wanted to work there. And thankfully, I was hired as the executive director now. And but I know good care when I see it. And I've been to some of the top the centers of excellence around the country, to be honest. And we just provide a level that's on a par with that. I mean, part of what we're trying to do is to keep people from having to travel, from having to go to faraway places. I mean, every time I go to, for example, my center in Texas, it's $2,000 between the flight, hotel, all these kinds of things. We want to make sure that level of care is available here so that people don't have to spend that kind of money and travel maybe when they don't feel well. I mean, it may not be convenient and it may not be a good time for them to be on and off of planes and things like that. We want to make sure they can access that level of care here.
We're talking with Steve Abbott, Executive Director of the Cincinnati Cancer Advisors, and I'm just amazed that all of this support, all this information that you are giving someone who just found out they have cancer is all free of charge.
Yeah. We were kind of founded on, the whole thing, if you think about it, it's a leap of faith. I call it, use a big high school word, hypothesis. But it's kind of founded on a hypothesis that that private donors may be willing to fund a level of care that is just not currently available. And it's not even an issue of whether you have to be affluent or whether you had to be wealthy. It sounds weird, but we're not in this to provide. It's not like indigent level care, even though it's a perfect outlet for that. But really, what we're in business to do is provide a level of care that you can't access. Even if you're affluent and you have great insurance, your insurance company is still only going to pay for that 30-minute visit. They're not going to pay for a 2.5-hour visit.
So it doesn't matter what your insurance is. It doesn't matter how much the doctor is charging. You guys are free.
Yeah.
Is there a form of cancer that you guys don't do?
Really not. I mean, really not. We don't see pediatric patients. We feel like that's pretty well covered here in Cincinnati.
We've got a big hospital here about kids.
We've got a place where people fly from all over the world for pediatric cancer.
But for adults, where do they go?
Yeah, exactly. And so we see every year we see at least 40 different cancer types, and we're fortunate in that. For example, our Dr. Phil Lemming he's been doing this for 40 years, and so he's seen virtually everything. But we also have subspecialties, and so Dr. Lemming, for example, is melanoma and skin malignancies. He's known worldwide for that. Our Dr. Jazzy is known for lung and colorectal cancer. Dr. Robin Zahn, incoming president of ASCO, which is the largest clinical oncology society in the world. She's our breast cancer expert. That's the level of care you're getting. So there's great subspecialty level care, but there's also great generalist level care for oncology here at Cincinnati Cancer Advisors.
So when you're given a diagnosis and the doctor tells you, boom, 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 needs to happen, your mind is swimming, call up the Cincinnati Cancer Advisors or go online. Where do we go online to find you guys?
It's a great question. CincinnatiCancerAdvisors.org. You can also call and make an appointment at 513-731-CARE, which is 513-731-2273. And if I can mention something else, Jim, you talked about it's great because your head is swimming with all this information. You'll receive a multi-page, in fact, I think on my visit I got like a 20-page. It was overwhelming, but like a written report, a checklist, all the information, repeating back what you heard. It'll be a very, very good guide to help you navigate your care.
I appreciate that. Steve Abbott, Cincinnati Cancer Advisors, CincinnatiCancerAdvisors.org. You can get everything there for you or someone you love. Thanks so much for coming in.
Thanks so much, Jim.